Hi guys, I'm here with Katie Noonan, who's a physical therapist here in Emporia, and I just decided that we could do a quick question and answer with her so we could answer some of the common questions that get asked. So Katie, let's go ahead and do a quick introduction about who you are and how long you've been treating and whatnot.
Okay, so I'm Katie Noonan. I'm a pelvic floor physical therapist. I've been doing pelvic floor therapy for 7 years now. I take all of my extra classes through the Herman and Wallace Pelvic Rehab Institute. And my goal is to become a certified practitioner in the next few years. But in order to do that, I have to get about 2,000 hours within a 2-year span to do that.
Awesome. So that means come visit Katie.
Yes.
Okay, so I'm just going to ask you some basic questions that you might get asked a lot, and then anyone that watches this can, if they have more, they can contact you. Okay, so first one, what is pelvic floor therapy?
Pelvic floor therapy is specifically helping to treat anything that has to do with the pelvic floor. So our pelvic floor muscles are in the pelvic, and they help support our organs such as our bladder, our bowels, and our genitalia.
Okay. What do I expect to benefit from pelvic floor therapy?
Generally, a person that comes in will get an improvement in their bowel function, reduction in urinary incontinence or improvement in urine symptoms, reduction in pelvic pain, help with back pain, improve stability in their core, and anything that has to do with the mechanics of the pelvic floor.
Okay, so kind of bouncing off that, what types of conditions do you treat?
I treat any type of urinary incontinence, so there's several kinds like stress, mixed, and urge incontinence. I help with constipation or bowel urgency and frequency, pregnancy-related pain, postpartum pain, any type of pelvic pain, pain with intercourse. Those are kind of the bigger ones I see, and then that goes into several other conditions. Pelvic pain is a very wide scope, and there's a lot of things that fall under that category.
Okay, so then also with that, can guys come to pelvic floor therapy?
Absolutely. They're not as common, but males have the same, not the same, but we all have a pelvic floor, and theirs functions a little bit differently, but yes, they can still have benefit from it.
Awesome. Are you currently seeing any guy patients?
I do. I have one that had a prostate removal and has had urine leakage since then, so we're just working on a lot of strengthening and functional training and breathing work to help with managing his symptoms.
Awesome. Okay, so for someone who comes in, what would their initial exam look like?
So typically I spend a lot of time discussing with the patient what their symptoms are, what their concerns are. I educate them on why I'm going to do an internal exam, which is when you do an internal pelvic exam, just like any other muscle in the body, your pelvic floor muscles can be weak, they can be tight, they can have trigger points in them. So I'm assessing all of that, and I'm assessing their strength. And the best way to do that is with an internal exam. That can be intravaginal or intrarectal. And I spend a lot of time assessing anything that can also contribute to pelvic floor dysfunction, including back pain, hip pain, just mobility in general. So anything like that could be included.
Awesome. So you kind of answered a little bit of my next question, but if you have anything else you can say. So do you do an internal exam, and how does that work and what happens?
So the pelvic floor has 3 layers of muscles, and at each layer I'm assessing your strength and tone and just your capabilities of being able to contract and relax those pelvic floor muscles. I'm also assessing for a prolapse. So a prolapse is when the organs actually can start to fall out of the vagina or the rectum. And that can be the bladder, the uterus, or the rectum can all prolapse. So I'm assessing for all of that as well.
Oh, okay. So this question I feel like I see online a lot. So why can I not just do Kegels to help my pelvic floor?
Yeah, so that's a big one. Most people, don't do Kegels correctly. So when they come in to see me, that is something I'm assessing. Do they know how to functionally contract those muscles? As well, just as importantly, is your ability to relax those muscles. So when muscles are too tight in the pelvic floor, it can actually cause urgency, frequency of urination. It can cause pelvic pain. It can cause bowel dysfunction. So a Kegel is not recommended for everyone, especially if they have any pain.
Okay, so the next question, can I come to pelvic floor therapy on my period?
Yes, so they have those devices called K-cups, I think.
Yeah. Sounds right.
But they're an inserted cup that will catch any blood flow. So we can do that. Or there's always external work that we can work on those days too. So I've seen several people during that time.
Okay. So the next one says, I'm pregnant. Can I still come to pelvic floor therapy?
Absolutely. So the pelvic floor is really important during and after pregnancy. Depending on how far along in the pregnancy someone is, we may or may not do internal work.
Okay.
But I can do internal work, and I'm just constantly assessing how they're feeling and how the baby's moving and doing okay as far as that goes. But yes, it is okay to come. And even more importantly, there's some of the people that should come.
Yes, it's encouraged.
Yes.
Okay, so then the last one I'll ask is, I'm trying to get pregnant. Can pelvic floor therapy help with that?
No. It can help just with pelvic floor symptoms in general. It can help with if you're having trouble having intercourse because of pain, we can definitely help with that. But pelvic floor therapy will not help specifically with fertility.
Okay. Interesting. Well, you heard from Katie, which was really awesome. Thank you for coming in.
Of course. Thank you for having me.
Yes. And so, again, I'll say it again. On the website, I have her information and the clinic's information. So if you have any more questions, or if you feel like something we said applies to you, feel free to come in and you can get an initial exam with Katie.
Yes.
Thanks, guys.